think that when I look back at my calendar, April 2nd, the day after April Fool's Day, I got a call from USDA and said, hey, we would like you to come and help us do some investigation in terms of why high path has moved from dairy cattle to poultry farms in Michigan. And that kind of was the start of this, what I call a bad drug for me. It's something that you can't get enough of, but you just wish it would go away. Unfortunately, it doesn't look like it's going away anytime soon. And it looks like California's in the middle of a bad place right now. So I just want to give a little bit of a background of some of my experiences and a lot of other people's experiences that I've talked to over the past 5+ months. So just a disclaimer that the findings and conclusions in this presentation are my own and should not be construed to represent any official USDA or US government determination or policy. I do not work for USDA any longer. I am under a cooperative agreement with them, but I did work for them for a number of years, as we have mentioned. So, and some of the data that we're going to present today was made in part by the agreement with USDA, and this presentation may not necessarily express the views of the Animal Plant Health Inspection Service, part of USDA. So just a little background on influenza virus. There's 4 types. A and B are seasonal. A is seasonal, and there's also been some global epidemics, but for the most part, if humans are going to get influenza, it's going to be A or B. Type C is a mild disease in people and really not associated with any epidemics. And then D is primarily found in cattle, which is the one you think we'd be talking about today. But unfortunately, it's not. It's influenza A, and that's divided into subtypes based on 2 surface proteins that are present on the virus. And so one's the hemagglutinin, or what we refer to as the H in the nomenclature, and then neuraminidase, which is the N. And so the current outbreak is an H5, which has been classified, and then an N1. And that's the one that we're dealing with now. So that's an influenza A in cattle. So just looking back at some dates, and I kind of think of this as telling a story about where we started. So if we go back a little over 2.5 years ago to February 8th, USDA confirmed high path HPAI in a commercial poultry flock, and I might be mistaken, but I think that was actually in a California flock. And then we fast forward 2 years, although those 2 years went by pretty slowly in terms of there were a lot of poultry that were affected by highly pathogenic avian influenza, or HPAI, in that time period. In early 2024, we had an uncharacterized cattle morbidity event occurring in Southwest United States, primarily Texas and New Mexico, with reports of large bird die-offs. I heard veterinarians say that they drive by a dairy and it would just be, the field next to it would be speckled with black dead birds. So large bird die-offs in those areas. There was a lot of work done by a lot of veterinarians in the Texas and New Mexico area. And then on March 25th, USDA confirmed highly pathogenic avian influenza had moved into dairy cattle. So on April 29th, about a month after first confirmation, USDA enforced the federal order. We'll talk a little bit about that just briefly. And then on June 29th, we published a Michigan Dairy Herd and Poultry Flock Investigation Summary, which gives us a little bit of information, at least in Michigan, about how the disease might have moved there, and hopefully we can extrapolate some of that into other states. As of today, 232 dairy herds in 14 states are affected. The current challenge is, I think, unfortunately, even though we're out almost 6 months tomorrow, is we don't know how this virus is moving from herd to herd. I think there's some speculation and there's some things that maybe we've ruled out, but we still don't really know for sure. How do we stop this? And I think that is still the biggest question to answer. So to the dairy producers out there, we really need help in getting more information on how this is moving herd to herd so we can stop it. How the virus is moving cow to cow is important, but if we can stop it from moving herd to herd, then we don't have to worry about the cow to cow part near as much. For younger cattle and non-lactating cows involved in this disease spread, I think there's some evidence that could be true, but we don't have enough to say that that's a primary cause. We know that lactating cows moved this virus out of the Texas Panhandle into multiple other states. And but once it got to those states, for the most part, it moved multiple ways, because we know a lot of those herds did not have movement of lactating cows or the introduction of any cattle of any kind into their herd, and they still broke with highly pathogenic avian influenza in their cows. So, and then the other thing that I think is a little bit scary is the reinfection or relapse already occurring on farms. Actually, I was on a farm, 2 farms today. Same ownership is the only reason we're on 2 farms in one day, and they're still seeing clinical signs, 5 to 10 cases a week on each farm, and they're out about since July 3rd. So 2.5 months, and the disease really has slowed down, but is still occurring on this farm, on these 2 farms. So this is the USDA website, Detections of Highly Pathogenic AI. If you scroll down a little bit, you can get to these maps that show a situational outdate. You can either choose the time period last 30 days or the total outbreak. So this was as of today, 232 herds since it started in 14 states. And California, unfortunately, started a few weeks ago, and now we're up to 34 livestock herds that have been confirmed with the disease since it started. This graphic, I didn't get this completely updated, but essentially California is now number 2, a position you don't want to be, but I'm from Colorado and we don't want to be in the first position either, with 64 herds, but California with 34, and it's moved pretty quickly in California, just as it did in Colorado, moved through a lot of herds in a very short period of time. So this is the federal order. So this came out on April 25th. And essentially what it requires was mandatory testing for interstate movement of dairy cattle. So they're required to receive a negative test for influenza A virus at an approved laboratory. And then if they do test negative, then they can move. If they test positive, then that needed to be reported up to USDA. The other thing that the federal order did, there was a lot of private laboratories doing testing, and this federal order required them to now report results of their testing to USDA. So this really restricted cattle movement of those cattle that were infected with influenza A, highly pathogenic influenza, and also required the labs to report to let everybody have a better idea of where this disease is occurring. This is just a graphic put out by CDC. How is it spreading? And I think that it kind of goes through what all the different transmissions that we've seen, wild bird to cow. So H5N1, HPAI has been, as I've shown, circulating in the U.S. since 2002, and it was a little over 2 years, and then we saw the first outbreak in dairy cattle. And based on all the whole genome sequencing that's been done to date, it appears that was a single isolated event where the virus moved from wild birds to cattle. This is not a continuing infection source for cattle. It's only been predicted to happen once based on the whole genome sequence of the virus that we've looked at, or the fingerprint of the virus. So not a continuing route of transmission. Cow to cow, although CDC reports is probable, we know we have cow to cow transmission. It's been reported in multiple states, multiple farms. Cow to poultry, this is one of the reasons that I ended up in Michigan, and that looks like maybe the primary cause was through shared workers. There were a number of workers that worked at the poultry plant during the week and then did dairy shifts on the weekends. And there was also co or shared housing that happened that could have been responsible for some of that transmission as well. So we know it's gone cow to poultry based on, again, the fingerprint of the virus. We can kind of track where it's been and tell how closely related some of these herds are. Cow to cat, we know we've had a lot of reports of farms that have lost many cats. Most of the cats that are close by the dairy farm, the milking parlor, reported dead cats prior to the presence of clinical signs in the cows. And but it appears that maybe about 2 weeks after the onset of clinical signs, that as those cows start producing antibodies and essentially neutralizing that virus, that then those cats are able to consume raw milk and not succumb to the virus. But cats are very susceptible to this virus. Cow to human, we know we've had that reported, and we'll go through, just mention the one case, the first case in Texas from cows to human. Human to human, when this graphic was put out a few weeks ago, none reported. The Missouri case that was just reported, I believe 2 weeks ago, that where the person that was infected had no contact with cattle, was not consuming raw milk, had no real contact with livestock at all, but did have a roommate or housemate that was potentially infected. So human to human is happening. We've heard it from many of our dairymen that they've taken it, either them or their workers have taken it home to their family members, mother-in-laws. So it is moving human to human, and we're not sure how that's whether they're just carrying it on their person as they take it home, or if they're actually infected and shedding, and that's how they're infecting their family members. Poultry to cow. So I mentioned cow to poultry earlier. In Michigan, we did have one poultry facility that was located close to a dairy, no known connections, and the sequence suggests that it did move from the poultry to the cattle. So one of the things we know about poultry farms is birds put out a lot of virus into aerosol that can move in kind of plumes. We haven't been able to demonstrate that in cattle yet, and I'm not sure if that's exactly how it's moving, but or one of the routes that it's moving. But in poultry, we do know we get these large plumes that can spread potentially multiple miles. And as I mentioned, no human.
Feel about the mercury.
Where's it coming from?
That's going to get debunked here. So this was the first human case of avian influenza in Texas. So this was a dairy worker, had direct contact with dairy cattle. So we primarily find the virus. We've been doing a lot of sampling of dairy cattle. I think we know that the major secretion we find it in is milk. So people that are milking the cows are probably the highest at risk to have exposure to this virus. Worker was taken to the medical facility, I believe, by the veterinarian, and unfortunately there was no follow-up with the person. But we've heard about this on a lot of farms where they're having this conjunctivitis or red eyes, and most of those are pretty mild in terms of they clear up over a few days. And we've talked to dairy owners that have also had these. And conjunctivitis isn't necessarily a rare event among workers that are out in the dust and feed and things, but more so in those that are milking the cows. All right, so this was a report we put out on the Michigan summary. So at the time, I believe we had 15 herds that we were able to look at pretty closely. We visited most of those herds. We went through the epidemiologic questionnaire, which is really important to gain additional information on the practices of those farms. And this is kind of generalized because we can't share specific information about movements in that. But this diagram here shows you kind of how the fingerprints of these are connected. So let me see if I can. Let's see. Oops. Must see if I can turn my pointer on. So this is this big, what we call these genomic clusters. So we had the two affected dairies that were very closely related, and then an affected poultry and another affected dairy that were kind of on the periphery, but very highly related genetically. And this is where we determined, yes, we did have movement of the virus from the dairy to the poultry plant. This other green cluster over here is primarily a poultry cluster, where we had movement from the poultry farms to a dairy. So we've had it move both ways. We did have it entered Michigan through a movement out of Texas. The herd in Texas was undetected at the time that those cattle moved, and then was detected after movements. So that's how it got to Michigan, and then how it moved around Michigan. There were a lot of different potential movements, and this kind of summarizes it. Sorry if the graphics aren't the best when we blow them up off the website, but 15 dairy herds and 8 flocks. We know we had the one herd confirmed to have imported the virus from Texas. A lot of these farms had acquired cattle from in and out of state, but we couldn't really pinpoint those as bringing the disease onto the farm. Some of these states that they'd acquired cattle from had no reports of disease, although we know that this disease is way underreported, except in probably states like Colorado, where they're doing bulk tank milk testing every week on all farms. Talking to some veterinarians, I think at some point we were probably maybe getting 10 to 25% of the dairies that were infected were actually reporting. Dairies are really busy places, so they're visited by numerous visitors, and not visitors in the sense that they're not necessarily people. They're people that are working on equipment. They're people that are delivering feed. They're people that are doing the DHI testing. There's just a lot of people that visited a working dairy as part of their routine business. We knew a lot of the dairies were visited by the same dead stock hauler in Michigan, and that's somewhat regional as well, because that's the dead stock hauler that was primarily available in that area for those herds. Milk trucks. We know that milk trucks are on dairies, even small dairies every other day, large dairies multiple times a day. And I'll talk about some milk truck sampling that we did in Michigan to try to see what the risk of milk trucks were. Shared workers, so workers from 6 affected dairies worked on other dairies, so potentially moving the virus that way. And then we talked about affected flocks. So the poultry flocks had shared housing and then shared workers as well. So once a herd is disclosed and confirmed with disease, one of the options, in addition to doing the EPI questionnaire, actually is pretty much mandatory, but we give these farms option of having wildlife services, which is also part of USDA, come in and do some wildlife surveillance. So capturing these animals and testing them. And they did find quite a few, or not quite a few, they found a handful really, probably less than 10% of all the peridomestic birds that were sampled had the high-path avian influenza virus. But that's really a reflection in my mind of a spillover from the cattle to the birds, not the birds bringing it in to the farm. Because if we think back, and I'll show you some data that shows that the virus is there long before you see animals with clinical signs. And in the case where we were on these farms collecting specimens from these peridomestic species, many times that's 2 to 3 to 4 weeks after clinical signs. So we're 6 weeks after the disease was introduced before we were sampling some of these animals. Just a reminder, this virus strain is not found in migratory waterfowl in Michigan or really any other states. I think that this strain has not been found in any wild birds in the US in 2024. So the wild birds initiated this in a dairy herd, but they are not continuing to spread it, is the message that we're getting from the genomic experts. So when we were in Michigan, milk trucks were high on our list just because of what we know about foot and mouth disease and spread of that virus in other countries. So we set up with the cooperation of the cooperative. We knew where most of the affected farms were shipping their milk. So one morning they allowed us to come and sample trucks. And so we sampled, we took about 8 samples from each truck and trailer. So we sampled the inside of the cab, the steering wheel, the handles, the rail to get into the cab of the truck. We sampled the tires of the truck. And then in the trailer, we sampled the sides. So you can see on this where they have the milk residues coming down. Down on the sides. We sampled the sides of the truck. If they did have a drain vent pipe that came down, we sampled the inside of that as well. We sampled the tires on the trailer. On the direct load trucks, we took the cap off and sampled some of this. Actually, they took the cap off because the seal was on. We sampled the floor of the direct load trailer, and then on the cabinets on the farm load, we sampled the hose, the floor. We sampled the cooler. We sampled the dipper. We tried to sample everything. We did see quite a few trucks that had raw milk that was present on the floor of these types of trucks, and we sampled that as well. So we sampled 18 milk trucks, and what we found was essentially one sample on a direct load truck was positive. So USDA refers to these as non-negative because they have to be confirmed by a laboratory, another laboratory. But essentially, in these samples that we took from 18 trucks, there were 126 samples we took, and we found one sample that was non-negative. So in our mind, milk trucks were not responsible for moving this virus in Michigan. Is that true in Colorado? Is that true in California? We don't have any, that I know of, no milk truck sampling was done in Colorado. I don't know if that's planned in California, but at least at this point, milk trucks aren't high on our list based on these samples that we took in Michigan. All right, so switching over to the cow side, clinical signs of high path, and thank you, Dr. Barb Peterson from Sunrise Veterinary Service that provided these photos to me. The first thing that we see and the first thing that we heard from veterinarians is at herd check, they're doing pregnancy evaluations and they're seeing feeling a lot of fevers, a lot of hot cows as they go in. This is a couple cows that she had thermometer readings on, so 106, 104. A lot of these cows had fevers. As far as the photo on the right shows some of the yellow, thick milk that mastitic looking milk that some of these cows presented with. This is a cow that had been detected with or been diagnosed with flu the day we got there. And I think the big thing that we see in a lot of ththese cows is just this clear nasal discharge. And you can see she's dripping from both nostrils. And sometimes you have to really look at these cows to appreciate the amount of serous discharge that they have coming from their nostrils. But she also has her ears down. She just doesn't look very happy. She's probably past the fever stage by the time we recognize her. And if you did a physical exam, you probably wouldn't find a lot going on with her other than maybe decreased rumen motility and decreased milk production. Otherwise, temperature's normal, heart rate's probably normal. They just look like they don't feel very good. We have other cows that kind of move maybe through and have some secondary pneumonia or other problems. This was a cow we sampled a few months ago at a dairy. She ended up getting euthanized not long after this photo. But some bloody nasal discharge from her. Actually, I took these photos this morning. This is this herd that's kind of chronic, and so now what we're seeing is instead of that clear mucus discharge, now we're starting to see more of a kind of a purulent discharge coming out of these nostrils. Sometimes it's hanging 6-8 inches down. We have another dairy that had a lot of cows that did have kind of bloody nose, but the cows seem like they feel pretty good. And that's one of the things that I've noticed and heard other veterinarians talk about is this disease does not seem to be the same on any two farms. It presents a little bit differently. And I'm kind of thinking maybe that's just the virus and the cows figuring out how they're going to work together through this. But just because you see it on one farm doesn't mean you'll see it on another. We heard about a lot of farms that had subcutaneous emphysema, so the cow looks like she's kind of blown up, has air under the skin. Some kind of unusual other clinical signs that you'd see other than the decreased rumen motility. But the nasal discharge is one we're seeing a lot of here in Colorado. This was another cow that we sampled that was peeling, and I mean peeling, it was pretty severe, and both back in her hips and on her withers, and she actually ended up getting euthanized too. Pretty thin cow as well. This is just a video of a cow. I don't know if it really shows too much other than these cows seem to just not be feeling well. They're just kind of, I've been told, they just kind of stare out into space. They're not sitting there chewing their cud. They're not keeping their muzzle clean. some of the things that you would expect a normal cow to do. And if this was happening on a few cows in your herd, you wouldn't necessarily be too worried. But when it happens to 25 or 50 cows on a single day to start with, then you start getting a little worried. So if we start looking at epidemic curves, or how many cases these farms are seeing of disease over a period of time. So this is four farms, like I say, 3 different states, and this is their curves. And so Farm A in the orange had 781 cases. That was 22% of their herd, and they saw clinical cases for 26 days. Farm K is the gray here, and this is an unusual because this farm essentially ran out of space in their hospital pen, and they had to convert lactating pens into their hospital pen. So every cow that looked crosswise at them, they essentially put them in the hospital pen on day 3, just so they could manage resources in terms of pen space. They only ended up with 7% of their herd showing clinical signs, but they saw clinical signs out to 38 days. So quite a prolonged disease presentation for them. A and L were pretty similar, 1,100 approximate cases, about 15% of their herd. One saw clinical cases for 16 days, and one saw clinical cases for 26 days. I think that some of these farms become a little bit numb over time after you've been pulling cows for 20 to 30 days. Some of those cases probably aren't going to get detected, and you're going to be triaging and really looking for the most serious cows in terms of illness that you need to treat. This is some cow manager data from one of the farms, and so the blue here represents the percentage of time that they're ruminating, and she was running right around 40 to 50% of her day ruminating, about 15 to 20% of her day eating in the green. Really not active for about 20% of the day, and then active for 6 or 7%, and then highly active for a percentage of her day. And you can see that she really drops down from the 40s down into the 20s, and eventually down into 11% of her day was ruminating, and about 1% of her day was eating, and 60 to 70% of her day was not active at all. So using some of this biometric data, these cows are pretty easy to pick out when it's going through your herd. This herd didn't have the temperature monitoring, which we know in some of those herds even detect a little bit earlier, where they could detect a fever about 12 hours before they saw the decrease in rumination. This is another system looking at that. So the orange is the daily rumination. This cow was ruminating about 500 minutes a day, and then dropped down to about 50 minutes per day. As far as milk production, she was running about 100 pounds over here on the right side axis, dropped down to less than 20, and then did recover and hovered in there in the 70, about 70 pound average. And that's what we've heard from a few people that have really looked at this, is that we see essentially a reshifting or shifting of the lactation curve, and those cows come back and produce about 30% less milk for the remainder of their lactation based on their previous set lactation curve. In the experimentally infected cows, they did find a lot of scar tissue in the udders of those cows that they infected. And so I think the big question is, what are these cows going to do when they go through a dry period and come back the next lactation? So we do have a couple of farms that are far enough out now that they've had cows that should be getting close to peak milk production. So at least we can look at peak and say, okay, well, how well did they do compared to their previous lactation prior to the onset of clinical signs and disease, and see if we're going to see future production impacts based on the amount of damage that's been done to the udder in some of these cows. So the treatment, this is a viral infection, so we generally don't prescribe antibiotics for this unless they have some sort of secondary bacterial infections. Pneumonia would be one. If they have a really bad mastitis, then maybe that's the time to reach for antibiotics. Anti-inflammatory drugs are usually recommended. We see a lot of aspirin use, and I've heard about runs on aspirin in multiple states. Electrolytes and rehydration are frequently addressed, and I think that's what we see as the most common thing where people are pumping these cows 2 to 3 times a day, just to try to get them through that 3 to 5 days where they're pretty sick. The other story that we heard was that we had a farm that moved their sick cows into a pen that they traditionally didn't use for sick cows, and it had some corn stalk windbreaks in it. And they said they deliver fresh TMR to those cows, but the cows ate the corn stalks like they were going out of style. So increasing fiber in the diet. We had another farm that we talked to after that put hay bales out in feeders in their sick pen, and they saw the same thing where the cows would just get around there. And I think they're just trying to kind of normalize their rumen again after the insult of the fever and the viral infection. So as far as herd level changes, and I appreciate Dr. Drew Megstad from Iowa State University. He had the opportunity to get some bulk tank milk samples from a herd that had collected them prior to clinical signs. So this cycle threshold is really the amount of virus that's detected. And he essentially said 38, and this is 0. And then as the number goes down for cycle threshold, the amount of virus goes up. So it's an inverse relationship. So this herd reported clinical signs here at day 0, but when they went back and they tested their bulk tank milk at about day 17, they could start detecting low levels of virus in the milk that really peaked with the highest amount of virus occurring about day 4 after the onset of clinical signs. So this virus was in the herd for over 2 weeks before we saw any clinical signs in the cows. So what happened out here 3 weeks before clinical signs is really what we need to focus on in terms of trying to determine how it spread herd to herd. And that's just really kind of impossible to do unless you're in an area where it's spreading pretty quickly like California is now. If we do testing at these times, the PCR, which is looking for the virus itself, is going to be negative. The ELISA, which is looking for antibodies to the virus, is also going to be negative. But as we get in here, the PCR is positive and the ELISA is negative. So it's going to take cows a little bit of time. And this is based on bulk tank milk, but you could look at this in terms of a cow level as well. The ELISA is going to be negative because it's going to take those cows a little bit of time to develop antibodies that are detectable. It looks like that's happening about 7 days after the onset of clinical signs, at least in this herd. And now, if we went in, those cows are going to be PCR positive and ELISA positive. And ultimately, as the cow sheds the virus and essentially eliminates the infection, those cows are going to become PCR negative. We're not detecting virus any longer, but that antibody response will still be there. They'll be ELISA positive. So this is how we can do a couple tests and get a good idea of where this herd is in terms of their infection. And you can actually use this in cows as well, just the dates are going to be obviously a little bit different. These are some of the herds I showed you earlier that had collected bulk tank somatic cell counts as well, or bulk tank milk samples, sorry. And they collected, a lot of these farms had 6, 7, 8 bulk tanks that they were getting samples on. So we looked at that over time, and they start out with a mid-20 is quite a bit of virus, and then as it goes up, there's less virus because that inverse relationship. And then once we get to 40, we said that's 0. So these farms would go along and just kind of bounce around to be really close to 0. These cows do seem to shed low levels of virus for a prolonged period of time in some herds. This herd, Farm AL, they went a couple weeks and then had a day where they were shedding again or detected in the bulk tank milk. And we were out 97 days before we saw the last bulk tank positive sample come out of that herd. So I think there's been some similar work that's been done in Texas that shows some of these herds can be detected on bulk tank for up to 3 months after clinical onset in the cows. So what's the impact on milk production and bulk tank somatic cell counts? And that's sometimes a really hard number to get because it depends on how the cows are managed on those farms. And if all the cows are kept in the sick pen that are sick, and they have the opportunity to do that for a long period of time, then you may not notice much in terms of milk shipped per cow per day that's going into the bulk tank, and the somatic cell count. So this farm that we looked at had a 16% increase in somatic cell count and only a 6% decrease in daily milk per cow shipped. What we really need to throw into that equation too is the total amount of milk that they shipped during that time, because that's where you're really going to see the decrease. But if you keep all the sick cows out of the tank for human consumption, you may not notice quite a dramatic difference on milk production and somatic cell counts. This farm had enough clinical cases that they couldn't keep them all in the sick pen. So now we saw essentially more than a doubling of their somatic cell count compared to the previous 30 days, and a 15% drop in daily milk production. So that's a smooth rolling 30-day average. I know at one point this herd shipped 22% less milk than they did in the 30 days prior as an average. So pretty big hit on their milk production and also their quality bonus based on the increase in somatic cell counts. So when this was first described, we heard it's really impacting second and later lactation cows and cows that are in mid to late lactation. So this is just farm A, and we do see that the blue, which represents the percentage of sick cows in the herd, is lower than the percentage of first lactation animals in the herd. So it does impact first lactation animals, but it doesn't impact them as much as it does the older lactation, later lactation cows. So 44% of second lactation, and then it was pretty similar as you went through the later lactations. But the point is, yes, it impacts first lactation to a slightly lesser degree, but you will still see it in first lactation cows. Farm K, we saw the same thing, although a little less dramatic, or more dramatic, I guess, decrease in first lactation animals compared to later lactation. As far as days in milk, Farm A, again, those early days in milk, a lower percentage of cows that were sick compared to what that population represented in the herd. And then as we get out 100 plus days, we see a higher percentage of sick cows show up in those categories. And so one of the things that I don't know if anybody's really looked at this, but is pregnancy status a risk for developing clinical signs? And we've got a lot of data. We just haven't had a chance to dig into that. It would make sense that those animals, as they're pregnant and somewhat immunocompromised, may be more susceptible to the virus, but we don't have any data yet to answer that question. Farm K, similar days in milk. They saw it more in the 200 days in milk and greater, as opposed to the first herd showed it more in the 100 and greater. This disease is causing a lot of death on farms. This dead truck, that white cow on top, it's hard to see. It was a photo from a long way away. Looks like she's standing on top of the other cows. I think early on, a lot of these cows went to slaughter because we didn't know what the disease was. Once the federal order came into effect, then these farms couldn't move these cows, and a lot of these cows did need to be euthanized. And that's what we saw on farms where we would sample cows in headlocks, and management would make the decision to euthanize some of those cows before they made it back to the parlor again. And we've heard about death loss in the 10 to 15% of the affected cows. So the farm that had 1,100 cases, they lost close to 111 cows. So one of the things that we're focusing on right now is this shedding. Where are cows shedding, and how long are they shedding, and what does that impact other classes of cattle on the operation? So really the objectives are looking at pre-weaned calves. Are they at risk? We know that on a lot of farms they're being fed non-pasteurized waste milk, non-heat treated colostrum that could contain the virus. And so what are they doing in terms of disease status and antibodies? What secretions are cattle shedding it? How long do they shed through those routes? And how soon can we find antibodies after infection? And then the other thing, that since we know it's primarily in milk, what level of contamination do we find in the parlor, and how long is it sticking around there? So On cows, we've been collecting nasal swabs, serum and whole blood, milk, urine. We were collecting feces initially, but of all the samples that were collected, there was one sample that was positive, and we decided to halt testing feces. It's a really hard thing to do PCR on for this test because of some of the inhibitors, and so the lab recommended that. We're doing the parlor environmental samples, looking at liners, drop hoses, gloves of workers, drains, and then other environmental samples looking primarily at lagoons and holding ponds and places where that virus could potentially be spread on fields and aerosolized and moved to other operations. So we collect these samples, most of the samples one time a week. We're collecting milk twice a week, and we've been doing that for 10 weeks. And we've got about 7 farms in Colorado that we're still working on. So this is a big chore to do, but we've done this with the great cooperation of the dairies, and we say, you just give us access to the cows, let us know which ones are clinical, which ones aren't clinical. We identify the cows with a colored ear tag. We just zip tie it to their management tag. We put a leg band on of a color that the farm isn't using. And so when they come into the parlor, we can easily figure out which cow that is. She's in position number 11. We collect a milk sample. We have a person that goes up and reads the ID of the cow for us so we can label the tubes as we go along. And then we follow these cows out to the headlocks, and that's where we'll do the nasal swabs, get urine, and also blood. I do want to say that as you can guess based on the nasal pictures of the nasal swabs that I showed, or the noses of the cows, those are the things that they hate the most. The nasal swabs are the hardest sample to get on these farms. All right, I'm just going to show a couple things. Here's another cow with some things. I'm sorry I'm going over a little bit. Nasal discharge is the primary clinical sign that we saw in the cows that we're sampling, primarily because the fevers were probably already passed. As I mentioned with PCR, the higher the number, the lower the virus. The lower the number, the more the virus. The higher the number, the less the virus. So I'm just going to show a couple of these. So let's just focus on this one cow here, 46982. These really short bars are days she was sampled but negative. And then in milk, we saw on the first sampling, she was a 10, so a lot of virus in there. And then very quickly, she jumped up into the 30s, which is a lot less virus. This is a log transformation. So a lot of virus down here, very little virus once we get up here. And these were cows that were just milk PCR positive. We didn't see it in the sample. These cows tended to have a nasal swab that was positive very early on and also positive in milk. But we did have the occasional cow like this 42493 where she had 3 nasal swab samples that were positive, again, at high CT values, low amount of virus or virus particles, and only positive in milk once. This cow on the end, 49842, she was a little bit unique too. The only one we saw where we had nasal swab positive twice. She was always positive on milk when we tested her, and she was also positive on urine once. So it seems as though the cows can shed it in different secretions. Milk is still the most common one that we see. These are just cows that tended to shed it in urine, which is another probably a little bit more frequently shed in urine than nasal swabs, but this is on one herd, and we need to have more data before we can really definitively say what's going on there. So a lot of people are involved in this. In terms of PPE, we've just been wearing masks. If we try to wear goggles, what happens here is everybody's got their goggles on their forehead because they get fogged up, and in a parlor, that's a bad idea. But getting milk samples and spend a lot of time doing that. So what are our next steps? We really need to figure out how this is moving farm to farm. Without that, I think we're doomed to have this continue to circulate. We are kind of continuing to gather herd level data to support equitable compensation. We've heard that producers are getting compensated somewhere 25 to 50% of what they've lost, when I think USDA initially announced they were going to try to support that at about 90%. So if we can show that there's more losses going on than what they're bringing in with their data, then maybe we can make that adjustment. And then continuing to collect samples to try to better describe what's going on, shedding patterns, and correlate with bulk tank somatic cell count. So a lot of people to thank, but I apologize for going over. Appreciate your time, and we can try to answer any questions.
Thank you very much, Dr. Lombard. So now we can go over